So, good morning, everyone. First, let me introduce myself. I'm Paurvi Bhatt, and I am with Medtronic Philanthropy, and I lead our efforts on improving global access in some focus countries, so many of which we're hearing about here, but specifically on cardiovascular disease, hypertension, and diabetes. An issue that is rolling out now is obviously a global concern, right as we're thinking about UHC. So for us, this particular forum is particularly important because in order to really mount a response to non-communicable diseases, we really have to understand this new environment that we're all working in. So again, on behalf of our company and the philanthropy, thank you for having me here. And I'd love to have Barry, Somsak, and Mirai please join us as we're getting ready for your panel. So as Marty already provided some context, we're going to continue the dialogue that we started yesterday, which was really starting to take these large concepts that we spent most of the day discussing and bringing them down into country context. I think one of the core things that was particularly important is to really hone in on what are the elements of partnership that really come through in how the country programs are coming together, and what about those partnerships is really germane in the UHC context. One of the points that Victor brought up, I think, again, is really important to note that a lot of the things that might be happening on the ground in these grassroots efforts are ones that could be lifted up and brought to scale, and to remind us to try and take some of our conceptual thinking and put that aside as we're hearing about what's happening on the ground. It's a unique opportunity to really learn from what's happening on the ground and then build it back up to what we need to do today. So with that, I'll call Somsak up first to talk about Thailand, and what we'll do is have each of the presentations and then do a couple of clarifying questions and then move on and then have a larger dialogue at the very end. So thank you Somsak.